Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we're in the wonderful studios of the Alan B. Levan Innovation Center, which is a collaborative entity between Broward County and Nova Southeastern University. And today we have some very interesting guests. We're going to be talking about speech, language, and communication for school kids to seniors. And let me introduce our first guest, which is Melissa Edrich.
Hi. Yes, hi.
How are you?
Good, happy to be here.
Tell me what all of those acronyms are after your name.
So the E.D.D. is a Doctor of Education, and the C.C.C. is a Certificate of Clinical Competence, and S.L.P. is Speech-Language Pathology.
Wonderful. And you're the Department Chair and Associate Professor of the MS-SLP program, which is at the wonderful Pallavi Patel College of Healthcare Sciences. So welcome. And let me also say hello to Jacqueline, Hinckley, Ph.D, C.C.C, S.L.P. also, and another one, Jacqueline, what is A.N.C.D.S?
A.N.C.D.S stands for Academy of Neurologic Communication Disorders and Sciences, and it simply means that I have board certification in helping people who have communication disabilities due to neurological problems.
Okay. And you're an associate professor in speech-language pathology. Well, it's a very interesting thing. We have a lot of, this show's been going on for well over 20 years, and we get our questions from our viewers. And I guess it's been going well because our viewers keep on asking questions. And we try to lead them to the knowledge. And I've always said that the strongest thing that we have on this earth is knowledge. It's not weapons, it's not philosophy, it's knowledge. It enables us to communicate as human beings. And talking about communication, and we got a lot of people that have sent us questions relative to speech issues, speech and language issues, everything from the small little children all the way up to the people that are affected by things like strokes, accidents, various sequelae now of this vicious pandemic that we've just come through. And let's talk a bit about your area of interest. We'll start with you, Dr. Melissa Edrich, and let us know the broad spectrum of your services.
So we work with a large spectrum of people. We work with pediatrics through geriatrics. I always say that it's a womb to tomb. Our scope of practice is so large. In one day, we could work with individuals with expressive language disorders, maybe somebody with autism, somebody who had a stroke. We also work with patients with swallowing disorders, with cognitive deficits due to traumatic brain injuries. We work with patients with voice disorders. We work with people with ALS or Parkinsons disease that have difficulty communicating. It's very rare to meet a speech-language pathologist who doesn't love what we do because our scope of practice is so large.
Well, again, getting to specifics relative to the broad spectrum that you both are involved in, one of the questions came to us about someone with GuillainBarre Syndrome. And explain what GuillainBarre is. Go ahead.
Jackie, you want to take this one?
Okay. Guillain-Barré can affect mainly speech. So the movement of the mouths and the muscles and the coordination. And so it can make it difficult for individuals to speak. And there are many other disorders that can cause similar, not exactly the same, but similar kinds of problems. And it is, it's when the nerves are not fully connecting with the muscles that we need to make speech or even to produce the voice that we use. So in cases like Guillain-Barre or other similar situations, speech pathologists can use many different approaches to help ensure the person can continue to communicate their needs, their ideas, their wants. I mean, we believe as a profession that communication is a basic human right. So we want to make sure that everyone can communicate, whether it's an ongoing problem or it's sporadic in the case of this individual who's asking the question. So we can use sometimes in some cases, we might use treatments that focus on the muscles and the movement of the mouth area or the voice. In some cases, we also use electronic devices or other tools that people can use to augment what they're saying. So if speech is difficult, even sporadically, there might be electronic devices that can help the individual continue to communicate. And that is called augmentative and assistive and alternative communication, AAC. And it's actually one of the big strengths of our department at Nova Southeastern University.
That's great. Again, we've had this plethora of questions in this area. That's why I'm so pleased to have both of you on. There is also, unfortunately, and I say this true, but so Florida has the greatest number of bike accidents in the entire. We're the lead state in bike accidents. That's what at least the various public health people tell me. Do you see a lot of these unfortunate victims of these accidents?
Absolutely. We work closely with patients who sustain traumatic brain injuries from accidents, motorcycle, bikes. Of course, we encourage all people to wear helmets, right? We have one brain and we need to keep that intact, because if they do get in accidents, there are neurological deficits, cognitive deficits they could have, communication deficits. It's life-changing having a traumatic brain injury, and getting that communication back is a process.
And Dr. Lippman, a related area is concussion. Mm-hmm. And that is in the news a lot as well. I don't know if you got any questions about it, but that can come about, as people participate in sports. Even like a mild hit on the head, whether it be in a car accident, bike accident, motorcycle accident, can produce concussion. And so there's a range of seemingly mild cognitive and communicative symptoms that can come from that, but they can persist for a long time. And they can really affect the person's ability to perform at their job, school, or what have you, all the way to more severe deficits from a very severe brain injury. And speech pathologists are involved in all of that, because many parts of the brain contribute to our ability to communicate. And so when there is a blow to the head and then injury to the brain, it's likely that communication in some way is affected.
So I'm vintage. So in my day, would say that the coach would say, and I played baseball, the coach would say, oh, just shake it off, just go back in and do it.
Well, I absolutely agree with you that in past times, we didn't know as much about the effects of these kinds of even mild hits to the head. And we didn't appreciate the long-term consequences. Now we understand that it can have immediate consequences on the person's thinking and ability to communicate, and that there can be long-term consequences. I think we've all seen in the news various celebrities who have had long-term, almost Parkinsonian consequences from, ongoing chronic multiple hits to the head, like boxers and so on. Mm-hmm. So we know a lot more about the brain, thank goodness. We also know about the effects of that. And so I think I think that we've learned so much more now. We can pay attention to things. You know, Dr. Lippman, in speech language pathology, when you bring up history, it's interesting because we as a field began working with people with brain injuries at the time of World War II, when soldiers were returning from the field with brain injuries and bullet injuries to their head. And as a field, that's when speech language pathologists came in to help these soldiers. So our field also has a long history in working in this area. And actually, we started with helping our veterans.
There's one other thing that has come up a number of times by our viewers, and I'll let either Dr. Ehrlich or yourself, Dr. Hinckley, to discuss it. Stuttering. What do we do about stuttering?
So that's an interesting question. And stuttering, as you know, is a fluency disorder where there's a disruption in speech flow. There is a lot of research in the area of stuttering, whether it's there's a genetic component, whether it's neurological, whether it's a learned behavior. What we do know is that we work with clients who stutter, and then it's not something that can be cured. It's something that can be controlled through therapy and techniques. Stuttering could affect little guys, little kiddos, all the way up through geriatrics. There is developmental stuttering. Stuttering could happen because of a neurological event. And as speech language pathologists, many of us work with clients to assist them with communicating better and learning strategies so they can speak more fluently.
We've had 2 or 3 communications from the viewers asking about what can I do about my child stuttering.
We have a clinic here on campus, a speech and language clinic, where we evaluate and treat a variety of clients. People within the community come for evaluations. We evaluate language and speech and cognition, and we have lots of services here at our clinic also, whether it's a pediatric client or a geriatric client. If stuttering is the issue and the main reason they're coming to our clinic, we actually have one of our faculty members specializes in the area of fluency disorders, and she would be the one that would be working with the client. And whatever level they're at, whether they're working on the word level, the sentence level, conversation. She works with people on things like practicing job interviews and answering the phone and very functional things, which to many of us, it comes easy, but for somebody with a fluency disorder, it's much more difficult for them to be able to express their wants and needs.
Just in case anyone's not within the distance of the Nova Southeastern University Clinic, our national organization, the American Speech Language Hearing Association, has an entire directory of providers. So I would certainly urge any parent to make sure that their child is getting a good evaluation by a certified speech language pathology and to follow the recommendations and the training of that person. And there are also many support organizations such as the Stuttering Foundation and other organizations. And that really goes for all of the communication disorders that we work with. So for example, my specialty is aphasia, which is a language disorder that comes about as a result of a stroke or a brain injury. And recently, aphasia was in the news because there's Bruce Willis and his family announced that he has aphasia. So many people have been bringing up questions about aphasia now. And so that's another situation where if somebody has had a brain injury, as we've been talking about and you've been bringing up, and even if they didn't get services at the time, they should certainly contact their doctor or contact a local speech language pathologist, because we can help those individuals. There are many well-supported and evidence-based treatments that can help these individuals to improve their lives.
Where is our clinic located here at Nova Southeastern University?
We are about 1.5 miles off of main campus. We are at 6100 Griffin Road. It's a big 3-story building that houses the Speech and Language Clinic.
Okay, and they can. We'll put up the telephone number and address. We'll put it up, but I think that's very important because I can tell you that we must have gotten maybe a dozen comments from viewers relative to stuttering and definitely to aphasia. I mean, people don't really know how this all happens. You touched one of you touched on Parkinson's before. It seems that there's a newfound, I guess, awareness of Parkinson's. That's not to say that people have not become more aware of a lot of healthcare problems, but I think it's because, again, the state of Florida, where they have the highest number of people over the age of 70, we have the highest percentage of people over 85. So I would assume, again, this is an assumption, that you're going to see a lot more of that style of problem in the elderly or the vintage.
I'll start. Maybe Dr. Edrich, you want to add on, but there definitely is a lot of focus. And fortunately, in speech-language pathology, we have several excellent evidence-based treatments that help people communicate better, because what happens in Parkinson's at first is many people, not everyone, but many people start to speak very softly. Their mouth doesn't move quite as much, and it's very difficult for them to make themselves understood. And there are treatments that help that. Beyond just medication, there are behavioral treatments that we can do as speech pathologists. Actually here at Nova Southeastern University, and maybe Dr. Edrich, you want to say a little bit more about it, but we have one of our faculty who's been running a fabulous collaborative group for patients with Parkinson's.
That's right. We have a faculty member who actually supports and works with patients with Parkinson's disease online. He has a Parkinson's disease support group, and the student clinicians actually assist the patients working on strategies to improve their expressive language. As Dr. Hinckley said, it is a degenerative disease, so the patient does get the symptoms and the issues do get worse as time goes by, and we do work on helping them use their muscles, use their voice to communicate better, louder, and we also work on swallowing. Patients with Parkinson's disease, in addition to having speech issues, many of them, because of the weakness, have difficulty swallowing too.
And one thing that's great to know, in the case of Parkinson's, which is degenerative, and many other conditions that are degenerative, when those individuals, even dementia, when those individuals get proper treatment, they maintain their function for much longer before it declines than they would if they didn't receive the treatment. So it is important for individuals to take advantage of the services that are available and not sort of give up hope, but rather realize that they can preserve their ability for longer if they engage in these services.
You know, you sort of almost jumped my next question, but let's talk about this for a second. We have the privilege here at Nova Southeastern University, the Health Professions Division, of having collaborative, shall we say, programmatic structures and delivery of services. You brought up the issue of dementia, because that is the next question that I was going to ask, because dementia, otherwise known in many worlds as Alzheimer's, or a road to Alzheimer's. Nobody really knows. We don't have enough true research. There's a huge amount of research that's going on right now with reference to dementia and Alzheimer's. So let's talk just a little bit more about dementia.
You're so right that many people immediately think of Alzheimer's disease, which is really only one of the different types of dementias. But dementia is simply a progressive deterioration of the brain, and some types of dementias affect certain parts of the brain first, or maybe the pathological reason that there's degeneration can vary from one type of dementia to the other. So sometimes some of the first symptoms of dementias can be difficulty with communication, finding words, remembering language or remembering verbal information. So speech pathologists definitely are involved in working with individuals with all these different types of dementia. There's even one particular type of dementia, or a subtype of one of the dementias, which is called primary progressive aphasia. And this is where the very early symptoms are aphasia. It's difficulty talking and there's no other symptoms. So we play an important role in helping to diagnose that. And actually many people usually aren't diagnosed for maybe between 1 and 3 years of having symptoms when it's the case of primary progressive aphasia. So it's very important to seek out diagnosis with this. Speech pathologists play an important role. Certainly as dementia progresses, as Dr. Edrich mentioned, we also play a role in swallowing, so we can support that in later stages if that becomes an issue. I'm a board member of the National Aphasia Association, and that is a national organization designed to give information to people about aphasia, including primary progressive aphasia. This is an interesting condition that actually wasn't identified until like 30, 40 years ago. So it hasn't been around as long for us to know as much. And so folks still have a lot of problems finding information if that is their situation. And National Aphasia Association is one way they can do it.
Well, thank you very much. We're down to the last minute and a half of this show. And I'd like to thank both Dr. Edrich and Dr. Hinckley for your kindness, your compassion, your knowledge, and your service. We're very proud of our speech and language programs. There are people that have closed programs all over the United States. Why, I don't know, and I'm not questioning it. But the bottom line is that we have this very active program, a very well-known program, and wonderful professional people who will really, we're blessed. We're blessed to have both of you and your colleagues. So thank you both very much for being here today and answering the questions of the people that have asked questions of me. Remember, we're coming to you from Nova Southeastern University. If you have any further questions, just go to this email address or telephone number and we'll get it back to these wonderful professionals. And remember, as I always tell you, don't hide from your doctors, don't hide from your healthcare professionals. Tell them what's bothering you. Don't be ashamed, tell them, because the only way that they can help you is by you telling them what your problem is. This program again is called Dateline Health. Until next time, my name is Fred Lippman. See ya.